Welcome back to Long Island Naturally. For the longest time, patients were told that if they tested negative for celiac disease, they could safely eat wheat and other gluten-containing grains. Now there's a growing consensus that you don't have to be a celiac to have a problem with gluten. My guest, Dr. Matthew Lewis, is a clinical nutritionist and chiropractor from Plainview. He's here to talk about the latest research which seems to show that gluten intolerance is not a black and white issue. Dr. Lewis, thanks so much for coming.
Thank you.
Before we get into that, what is celiac disease for people who don't know?
Celiac disease is an autoimmune condition that causes the body, basically when a person eats wheat, to break down the intestines. So they have really a devastating condition that affects their intestinal tract.
And it interferes with their ability to absorb nutrients, correct?
Sure.
So they become ill. People develop osteoporosis, et cetera, right? Tell me about the new research. There's a study from the University of Southern California that says there's a whole spectrum of gluten-related illness.
Right, so this is really critical research here because it changes the way we look at and diagnose celiacs. Celiac disease, the one we just talked about, is the least common of all the gluten disorders.
Okay.
So the person who, like you think about, who's really skinny and they have these loose stools and they look sick, that's who the doctor would normally pick out and say, oh, that person must have celiacs. But actually, the majority of people who have a sensitivity to gluten or a gluten disorder have atypical celiacs or a gluten sensitivity. So those people at home that are sitting down and they have like a belly ache and they have irritable bowel and they progressively gain weight and they can't actually lose weight. So instead of being thin, they're actually gaining weight. Those are the majority of people who actually have a gluten disorder.
What is the importance of the recognition of these new diseases?
Well, in the healthcare system right now, these people are totally being missed. Only 1 out of every 13 actual celiac patients is identified in the United States. In Europe, it's 1 in 5. So with these new classifications, not only are we going to start to identify those with a classical celiacs, but you're going to start to see all these people, these cases, that they're bouncing around from doctor to doctor. I have these complaints. I have headaches. I have a thyroid condition, and no one, or I'm anemic, and they're not being caught. So now with the new classification, we look at family history, we look at what's going on with their symptoms, and then we run the appropriate lab tests, and you can come to a conclusion whether or not this person needs to be off wheat. So it becomes a primary suspect as opposed to before where it was an afterthought, and it would generally take someone 10 years to get a diagnosis of celiacs. Now you can get a diagnosis of a gluten disorder if you're in the right place rather quickly.
Okay, let's go over some of those symptoms. You mentioned a couple. There's loose stools, constipation, acid reflux, stomach pain, bloating, joint pains, depression, fatigue, I think that's a very big one, and inability to lose weight. That's surprising because most people assume that if you're not digesting your food, you're not putting on the pounds.
Right. Well, if you're not digesting your food, you're creating inflammation in the intestinal tract, and you develop what's called a leaky gut. And some people may have heard of that, but just real quickly, a leaky gut means that the barrier in your intestine has opened up, and now nutrients can pass into the immune system that shouldn't. So you become hyperactive, and it changes your hormones, and you gain weight.
Now, I mentioned osteoporosis, but I understand, is it just gluten intolerance that could lead to some serious diseases, or do you have to be a celiac to be concerned about these serious diseases?
No, again, celiacs is just the smallest tip of the iceberg. Those people who have a gluten disorder, atypical or gluten sensitivity, can develop osteoporosis, thyroid disease, diabetes, right? These are the later stage progressions of being inflamed.
Okay, why do you think so many people are having problems with gluten?
Yeah, number one, I think it comes down to susceptibility. So we live in a culture right now that loves antibiotics. We like our soda, we like our coffee, and I don't want to say we like our stress, but we have plenty of it. And so
we also like our wheat. Don't we eat it like 3, 4, 5 times a day?
Sure, but people have always eaten wheat. So wheat is not, I don't want to pin everything just on wheat. It's if we were sitting in this room together and there was a virus that walked in and one of us were more susceptible, that's the person who might get sick. The other person might not. So why doesn't everybody who eats wheat become ill? Right? Only a certain percentage of the people do, and the reason is most of those people have a leaky gut from lifestyle. So you have to repair the leaky gut, and then a person who's gluten sensitive actually might be able to eat wheat again and be okay.
I understand that a lot of our wheat is now being genetically modified.
Right.
What do you know about that?
Yeah, so that's the other factor, right? We used to use heirloom seeds, so those are the old seeds. And so when you look in biblical times, you had, good wheat, let's say. Now, what happens is they cultivate the seeds, they change them, and you get what's called a dwarf plant. And those plants are really dangerous because they have something called amylopectin A, which is like a super starch. And when you eat that wheat, you get a spike in insulin. So a spike in insulin causes a surge of inflammation. So again, we're back to inflammation of the digestive tract. And so the wheat is definitely different, 100%. Now add to that the fact that you have these super starches in it, you have a leaky gut, we start to have problems.
Yeah, I'm afraid we're out of time, but thanks so much. That was great information. And thank you for watching. Tune in each Wednesday for my weekly reports on alternative medicine and natural lifestyle choices. For Long Island Naturally, I'm Mary Mucci. Enjoy the rest of your weekend.